Tell us why your channel is called Dr. ApoE4.
Well, the reason why is because I personally have an ApoE4, so it is an area of interest to me as far as diminishing risk of ongoing neurocognitive decline in individuals who are at risk of late onset dementia.
Who is Grant Fraser, MD?
I went to medical school at UC San Diego, did my undergraduate at UC Riverside, and have done 5 different certifications. I have a video on that.
What is concierge medicine and how does it work in a telemedicine format?
Yeah, so concierge medicine is medicine that is done outside of normal insurance. So it is something where we take no insurance. We don't deal with insurance companies, but we provide premium level services. And this is something where this is care that you're not going to get within the current establishment. And then by telemedicine, we go across 10 different states. You can see on the website as to which states I'm licensed in, and also I have a video on that. So it is something where you can meet with us from the convenience of your home. Very rarely we'll have the situation in which somebody needs to go and get a physical exam for something. And in the event that that happens, we will let you know if there's something where we don't feel that we can safely take care of this from your home.
What is your approach to longevity medicine?
The approach is to make sure that we take care of all of the basic things first, the things that can kill and disable you that have high-level evidence for them. And then after that, we will offer and discuss some of the clever options that some people are interested in, such as rapamycin, SGLT2 inhibitors, low-dose lithium, peptides. There's a lot of things in this space, but it is something where we need to make sure that we take care of the most important things first, the things that actually could kill or disable you that we have high-level evidence for.
What sets your approach to neurocognitive health apart?
So I think with us, we do monitor somebody's neurocognitive health. We use something called CNS vital signs, which we will track over time and give you some advice on how to utilize that to improve your skills over time and hopefully improve your scores rather than have them decrease with time, which is a typical. We also think that there is evidence for things that diminish your likelihood of neurocognitive decline. And this is something which sets us apart from standard practices where they simply watch you decline. And then once you decline, they'll end up offering you medications which are not disease modifying. And you end up having a ongoing decline and they tell you this is kind of inevitable and there's nothing that can be done. We like to preempt that and have people on treatments which are very much associated with a decreased risk of neurocognitive decline. There are some combinations that have evidence for as much as a 70% risk reduction. So these are the type of things that we focus on in our practice.
How is your primary care different from traditional clinics?
Well, it has a lot in similar, but it has a lot of things that are different. We actually provide comprehensive care. So where you'll go in there and you've got some type of endocrine problem, they'll send you to an endocrinologist because they don't know how to manage it or they don't have the time to manage it. We take care of that. You have a dermatology issue that's non-surgical, we'll take care of it. You have a cardiology issue that doesn't require a procedure, or nephrology, rheumatology. All these areas are things that we are comfortable managing. So we're not going to be sending you out for referral after referral with you waiting in people's waiting rooms and getting disconnected care. So this is something where we have comprehensive care. And there are some times where we need to refer you and we know when those times are. So that is a big convenience for you as a patient. Next thing is in regard to what our goals are. So when you take a look at the evidence-based protocols that a lot of the primary care physicians use, they're going to let your lipids be up, they're going to let your blood pressure be up, they're going to let your blood glucose be up significantly before they address it, and then they won't work on reversing it. So we are going to be looking at optimizing things, tracking things, preempting things before they happen, and being quite proactive to diminish your risk of all types of bad health outcomes.
Tell us what patients can expect in their first consultation and ongoing care with you.
So the first visit is a great opportunity for us to meet you, go through everything in detail. And there's a lot to it. And it is something where we try not to overwhelm people because so much of this is stuff which you've not visited before, you're not aware of, where we go through and make sure that we really have a good understanding of your health situation so that when I tell you your heart's good or that your brain's good, I actually have evidence to back that up rather than lab tests which aren't actually very reliable. So we do a lot of detailed discussions and make sure that we actually have a great understanding of where your health situation is, and then we can move forward with that. Can be a little bit overwhelming. Typically a 90-minute visit, something where I typically am going to put in about 45 minutes of prep time, and usually ends up taking me about an hour or so to go through and order this stuff, communicate with you, do your record, which then you can see on our electronic medical record. But it's a lot of detail, and it is something where we want a subsequent visit, oftentimes a couple subsequent visits, to just go through some of the results, really make sure that we're on the same page and that you understand exactly what our assessment of your health is.
Tell us how people can get started with your practice.
So how this works is that on our website, we have a request to be a patient button in the upper right. We want you to go ahead and click on that, fill that in, because that gives us the essential information. Please give us as much detail as you possibly can so that we understand your situation, what your goals are. And then you will end up following up with Yvette, my wife, who will end up having a chat with you and just make sure that we're going to be able to do the things that you're hoping that we're able to do. And then we get you onboarded with our membership contract, and we can go through all of that at the time.
What is your vision of the future of longevity medicine?
I think that this is probably one of the most complex areas in medicine that people work in, because there's changing data. We have things where we think it's one way, and then we get some articles that look pretty compelling that we need to do things differently. So this is something where we're keeping up to date with the newest literature and being aware of the entire range of possible. And that is one of the big things with being in the space, is that we understand all the things that standard medicine offers, and then all the things that functional medicine offers, and then things like peptides, things like rapamycin, things like dazipanib, supplements. There's just so much out there, and keeping up with this is actually a real challenge, and we get a great education from many of our patients who are keeping up with all this stuff and give us information, and we look through it and go, this is interesting. But I think that this is going to be a constantly evolving area. We have good level evidence for most of the things that we're recommending. Some of the stuff is speculative, and some of that will change. And I think that this is a great area of medicine to practice in. And the biggest thing with longevity medicine, speculative items, is that we make sure that anything that we would say, you probably do this, it's probably reasonable to do, it looks pretty good, is that we make sure that the downside is very small. There's not an expensive thing, and that there's not a significant rate of side effects. So that's kind of where we see the future, but it is a academic endeavor, and it takes a lot of work to keep up with all of this stuff. And we get better with time, we'll get more information with time.